Cancer is a word that can strike fear in anyone, but early detection can make a world of difference. Many cancers begin with subtle symptoms that are easy to overlook or dismiss as minor health issues. In this video, we'll explore some of the most common early warning signs of cancer that people often ignore. By understanding these symptoms, you can be more proactive about your health and seek medical advice when necessary. Remember, catching cancer early can significantly improve the chances of successful treatment. Let's start by understanding why these signs are often missed and why paying attention to your body is so important. Early detection of cancer can be life-saving. When cancer is found at an early stage, it is often easier to treat, and the chances of recovery are much higher. Unfortunately, many people ignore the early warning signs, either because they seem insignificant or because they are unaware of what to look for. This is why it's crucial to be informed about the potential symptoms and to listen to your body. In the following scenes, we'll break down the most common early signs of cancer and explain why they shouldn't be ignored. One of the earliest and most common signs of cancer is unexplained weight loss. If you find yourself losing weight without making any changes to your diet or exercise routine, it could be a red flag. While weight loss can be caused by many factors, sudden and significant loss should always be checked by a healthcare professional. This symptom is particularly common in cancers of the stomach, pancreas, esophagus, and lungs. Don't ignore unexplained weight changes. Your body may be trying to tell you something important. Feeling tired is normal after a long day, but persistent fatigue that doesn't improve with rest can be an early sign of cancer. This type of fatigue is different from everyday tiredness. It can feel overwhelming and may interfere with daily activities. Cancers such as leukemia, colon, or stomach cancer often cause this kind of exhaustion. If you find yourself constantly drained, even after a good night's sleep, it's time to pay attention and consult your doctor. Discovering a lump or swelling anywhere on your body can be alarming. While not all lumps are cancerous, any new or unusual lump should be evaluated by a healthcare professional. Lumps can appear in the breast, testicles, lymph nodes, or soft tissues. Early detection of these changes can be crucial, especially for cancers like breast, testicular, or lymphatic cancer. Don't ignore any new growths or persistent swellings. Get them checked as soon as possible. Your skin can reveal a lot about your health. Changes such as new moles, changes in existing moles, or unusual skin discoloration can be early signs of skin cancer or other types of cancer. Look out for moles that change in size, shape, or color, or develop irregular borders. Skin that becomes itchy, bleeds, or doesn't heal should also be checked. Regular self-examination and prompt medical attention can make a significant difference. A cough that won't go away or a persistent hoarse voice can be more than just a lingering cold. These symptoms are often associated with respiratory infections, but if they last for more than 3 weeks, they could be early signs of lung, throat, or laryngeal cancer. Pay attention to any cough that is persistent, gets worse over time, or is accompanied by blood. Don't hesitate to seek medical advice if you notice these changes. Pain is your body's way of signaling that something is wrong. While many aches and pains are harmless, persistent or unexplained pain can be an early sign of cancer. For example, headaches that don't go away could indicate a brain tumor, while back pain might be linked to cancers of the colon, rectum, or ovaries. If you experience ongoing pain without a clear cause, it's important to get it checked out. Noticeable changes in your bowel or bladder habits can be an early warning sign of cancer. This includes persistent diarrhea, constipation, blood in the stool or urine, or changes in the frequency of urination. These symptoms are often associated with colon, bladder, or prostate cancer. If you notice any of these changes lasting more than a few days, it's important to consult a healthcare provider. Difficulty swallowing, also known as dysphagia, can be a symptom of throat, esophageal, or stomach cancer. If you find it hard to swallow food or liquids, or if you experience pain while swallowing, don't ignore it. This symptom can sometimes be accompanied by unexplained weight loss or a feeling that food is stuck in your throat. Persistent swallowing difficulties should always be evaluated by a doctor. Unusual bleeding can be a sign of several types of cancer. This includes coughing up blood, blood in the stool or urine, or abnormal vaginal bleeding. While there are many non-cancerous causes for bleeding, it's important not to ignore these symptoms, especially if they are persistent or unexplained. Early investigation can help identify the cause and lead to timely treatment if necessary. A sore that doesn't heal, especially in the mouth, on the skin, or on the genitals, can be an early sign of cancer. Oral cancers, for example, often start as persistent mouth sores. If you notice a sore that lingers for more than 2 weeks, or one that bleeds easily or becomes painful, it's time to get it checked. Early diagnosis can make a significant difference in treatment outcomes. Occasional indigestion or heartburn is common, but persistent symptoms can be a warning sign of stomach or esophageal cancer. If you experience ongoing discomfort, bloating, or a burning sensation in your chest after eating, don't ignore it. These symptoms may be subtle at first, but can become more severe over time. Persistent indigestion should always be evaluated by a healthcare professional. A fever that doesn't have an obvious cause and lasts for several days can sometimes be an early sign of cancer, especially blood cancers like leukemia or lymphoma. While fevers are common with infections, persistent or recurring fevers without a clear reason should be investigated. Your body may be trying to fight off abnormal cells, so don't ignore this important signal. Night sweats are episodes of excessive sweating during sleep that can soak your clothes and sheets. While they can be caused by infections or hormonal changes, persistent night sweats may be an early sign of lymphoma or other cancers. If you experience night sweats regularly and can't find an explanation, it's important to discuss this with your doctor. A sudden loss of appetite or feeling full quickly can be an early sign of certain cancers, such as stomach, ovarian, or pancreatic cancer. If you notice that your eating habits have changed without a clear reason, or if you feel full after eating only a small amount, it's important to pay attention. These changes can be subtle, but may indicate an underlying health issue. Lymph nodes are small glands that help fight infection. Swelling in the lymph nodes, especially in the neck, armpit, or groin, can be a sign of infection, but persistent swelling may indicate lymphoma or other cancers. If you notice swollen lymph nodes that don't go away after a few weeks, it's important to get them checked by a healthcare professional. Headaches are common and usually harmless, but persistent or severe headaches that don't respond to usual treatments can be a sign of a brain tumor or other cancers. If you experience new or worsening headaches, especially if they are accompanied by vision changes or nausea, it's important to seek medical advice. Back pain is a common complaint, but chronic or unexplained back pain can sometimes be a sign of cancer, especially cancers of the spine, colon, or ovaries. If your back pain doesn't improve with rest or standard treatments, or if it's accompanied by other symptoms like weight loss or fatigue, don't ignore it. Bone pain or unexplained fractures can be an early sign of bone cancer or cancers that have spread to the bones. If you experience persistent pain in your bones, or if you suffer fractures from minor injuries, it's important to get checked. Early diagnosis can help prevent further complications and improve treatment outcomes. Persistent abdominal pain or swelling can be a sign of cancers such as ovarian, liver, or pancreatic cancer. If you notice ongoing discomfort, bloating, or a feeling of fullness in your abdomen, especially if it's accompanied by other symptoms like weight loss or appetite changes, consult your doctor. Shortness of breath or difficulty breathing can be an early sign of lung cancer or cancers that affect the chest area. If you find yourself getting winded easily or struggling to catch your breath, especially without exertion, it's important to get evaluated. This symptom can also be accompanied by a persistent cough or chest pain. Bruising easily or developing unexplained bruises can be a sign of blood cancers like leukemia. While minor bruises are common, frequent or large bruises without a clear cause should be checked by a doctor. This symptom is often overlooked, but can be an important early warning sign. Persistent itching, especially without a rash or other obvious cause, can be an early sign of certain cancers, including lymphoma and liver cancer. If you experience ongoing itching that doesn't improve with standard treatments, it's important to discuss this with your healthcare provider. Sudden changes in vision or hearing can sometimes be linked to cancers affecting the brain or nerves. If you notice blurred vision, double vision, hearing loss, or ringing in the ears that doesn't go away, it's important to get evaluated. These symptoms may be subtle but should not be ignored. Difficulty speaking, slurred speech, or trouble understanding language can be a sign of cancers affecting the brain. If you or someone you know experiences these symptoms, especially if they come on suddenly, seek medical attention immediately. Early intervention can make a significant difference. Nausea and vomiting are common symptoms for many conditions, but persistent or unexplained nausea can be a sign of cancers such as brain, stomach, or pancreatic cancer. If you experience ongoing nausea or vomiting without a clear cause, consult your doctor for further evaluation. Excessive sweating, especially at night or without obvious cause, can sometimes be an early sign of cancer. This symptom is often associated with lymphoma or other blood cancers. If you notice unusual sweating patterns, especially if they are persistent, it's important to discuss this with your healthcare provider. For women, changes in the menstrual cycle, such as heavier or irregular periods, can sometimes be a sign of uterine, cervical, or ovarian cancer. If you notice significant changes in your cycle or experience bleeding between periods, it's important to consult your doctor. Unusual discharge from the body, such as vaginal discharge with a strong odor or unusual color, can be a sign of cervical or vaginal cancer. While infections are a common cause, persistent or unusual discharge should always be evaluated by a healthcare professional. Bloating is common, but persistent bloating that doesn't go away can be an early sign of ovarian or gastrointestinal cancers. If you notice ongoing bloating, especially if it's accompanied by other symptoms like abdominal pain or changes in appetite, consult your doctor. Changes in the mouth, such as white or red patches, sores, or lumps on the tongue or inside the cheeks, can be early signs of oral cancer. If you notice any persistent changes in your mouth, especially if you use tobacco or alcohol, it's important to get checked. A sore throat that doesn't go away, especially if it's accompanied by difficulty swallowing or hoarseness, can be a sign of throat or laryngeal cancer. If you have a sore throat lasting more than 2 weeks, it's time to consult your doctor. Difficulty urinating, such as trouble starting or stopping, weak flow, or pain, can be a sign of prostate or bladder cancer. If you notice changes in your urination habits, especially if they persist, it's important to seek medical advice. Cramps are common, but persistent or severe cramps, especially in the abdomen or pelvis, can be a sign of cancers such as ovarian or colon cancer. If you experience ongoing cramps that don't improve, consult your doctor for further evaluation. While gas is a normal part of digestion, persistent or excessive gas can sometimes be a sign of gastrointestinal cancers. If you notice ongoing gas, bloating, or discomfort, especially if it's new or worsening, it's important to get checked. Hiccups are usually harmless, but persistent hiccups that last for days or weeks can be a sign of cancers affecting the diaphragm, liver, or brain. If you experience ongoing hiccups without a clear cause, consult your doctor. Swelling in the arms, legs, or other parts of the body without an obvious cause can sometimes be a sign of cancer, especially if it's persistent or worsening. If you notice unexplained swelling, especially if it's accompanied by pain or changes in skin color, seek medical advice. Numbness or tingling in the hands, feet, or other areas can be a sign of cancers affecting the nerves, such as brain or spinal tumors. If you experience persistent numbness or tingling, especially if it's worsening, consult your doctor. Dizziness or problems with balance can sometimes be linked to cancers affecting the brain or inner ear. If you notice ongoing dizziness, unsteadiness, or frequent falls, it's important to get checked, especially if these symptoms are new or worsening. Coughing up blood, even in small amounts, is never normal and can be a sign of lung or throat cancer. If you notice blood in your sputum, seek medical attention immediately. Early diagnosis is crucial for effective treatment. Chest pain can have many causes, but persistent or unexplained chest pain can be a sign of lung or esophageal cancer. If you experience ongoing chest discomfort, especially if it's not related to physical activity or heart issues, consult your doctor. Hoarseness that lasts for more than 3 weeks can be a sign of laryngeal or thyroid cancer. If your voice remains hoarse without an obvious cause, it's important to get checked by a healthcare professional. A persistent feeling of fullness, even after eating small amounts, can be a sign of stomach or ovarian cancer. If you notice this symptom along with weight loss or bloating, consult your doctor for further evaluation. Recognizing the early signs of cancer can make a significant difference in treatment outcomes. While many of these symptoms can be caused by less serious conditions, it's important not to ignore persistent or unexplained changes in your body. If you notice any of the warning signs discussed in this video, consult a healthcare professional for proper evaluation. Early detection saves lives, so stay informed, listen to your body, and prioritize your health. Thank you for watching and taking a proactive step towards your well-being.